Tuberculosis or TB remains one of the most pressing public health concerns in the Philippines. Despite being preventable and curable, TB continues to affect thousands of Filipinos every year, particularly those in low income and overcrowded areas. The National Tuberculosis Control Program, or NTP, is the Department of Health's flagship program to eliminate TB as a public health problem. It aligns with the WHO's End TB strategy, which envisions a world free of TB by 2035. The Philippines is consistently ranked among the top high burden TB countries globally. According to the World Health Organization data, the country records over 500,000 TB cases annually. What is most concerning is that TB mainly affects adults in their productive years, typically between 15 and 54 years old. This means it not only causes illness but also impacts families' income and national productivity. Another growing concern is the rise of drug resistant TB and TB HIV co infection, which make treatment more complex. Drug resistance develops when treatment is incomplete or inconsistent. This is an area where nurses play a critical role in promoting adherence and monitoring outcomes. TB is caused by the bacterium Mycobacterium tuberculosis, transmitted through airborne droplets. When an infected person coughs, sneezes, or talks, microscopic droplets containing the bacteria can be inhaled by others. Infection usually occurs after prolonged exposure, especially in poorly ventilated, crowded places like homes, prisons, or factories. That is why TB is often called a disease of poverty, as it is spread through social conditions that are linked to poverty. Understanding social determinants such as housing, nutrition, and access to care is crucial to designing effective prevention strategies. The hallmark sign of tuberculosis is a persistent cough lasting 2 weeks or more. Other symptoms include fever, chest pain, and night sweats, often accompanied by fatigue and weight loss. This may seem mild at first, causing patients to delay consultation, which contributes to transmission within the home and the community. As public health nurses, we should encourage early consultation and ensure patients understand that TB is curable with proper treatment. The NTP's vision is simple yet powerful: a TB free Philippines. Its mission is to ensure that every Filipino has access to quality TB prevention, diagnosis, and treatment services, grounded on equity, accessibility, and community participation. This means that regardless of where a person lives, whether in an urban slum or in a mountain barangay, they should have the same opportunity to receive diagnosis and treatment. As PHN, this is not just a program goal, it is a moral commitment to health, equity, and justice. The National Tuberculosis Control Program aims to reduce TB mortality and prevalence by 90% by 2035. It also seeks to achieve at least a 90% treatment success rate and to detect and treat 70% of all estimated TB cases. These targets are ambitious but achievable when surveillance, education, and community engagement are strong. Every cured patient is a step closer to breaking the chain of infection in the community. The directly observed treatment short course or DOTS or DOTS is the core strategy of the NTP. Under DOTS, a health worker or trained volunteer observes the patient taking the medication daily, ensuring adherence and reducing drug resistance. DOTS or TB DOTS combines four essential pillars: political commitment, accurate diagnostics, reliable drug supply, and effective monitoring. This is not just about medication, it is about system wide accountability as highlighted in the World Health Organization and DOH guidelines. Nurses act as TB dot supervisors, educators, and motivators, ensuring patients complete their 6 to 9 month medication regimen. The TB DOTS approach is built on five components: political and financial commitment. The government support ensures sustained funding and priority in health budgets. On quality assured laboratory services, proper diagnosis is critical to avoid mismanagement. Third is uninterrupted supply of effective anti TB drugs. Stockouts lead to resistance and treatment failure. And fourth is the comprehensive recording and reporting. Accurate data allows evaluation and strategic planning. PHNs ensure that each of these pillars functions effectively at the community level. Diagnosis starts with sputum smear microscopy, the gold standard for TB detection. Modern tools like the gene expert machines allow rapid testing, including detection of drug resistant TB strains. Treatment lasts 6 to 9 months, following the standardized regimen under strict supervision. Nurses play a crucial role in monitoring adherence, managing side effects, and providing emotional support to patients and family. Early and complete treatment not only cures the individual, but also prevents further transmission in the community. Diagnosing TB in children is more challenging because symptoms are often nonspecific, such as fever, poor appetite, or weight loss. Public health nurses must be proactive in household contact tracing, especially when an adult is identified. Children exposed to TB but not yet sick are given preventive therapy to stop disease progression. This preventive approach is a key part of breaking the chain of infection, protecting the next generation from tuberculosis. HIV weakens the immune system, making individuals highly susceptible to TB infection. That is why DOH promotes integrated TB HIV services, where clients are offered both TB and HIV testing, counseling, and treatment. Nurses coordinate care between these programs to ensure treatment continuity, adherence, and emotional support, especially since stigma remains a barrier for both diseases. Integration is a hallmark of effective community health systems, meeting multiple needs in one encounter. Effective TB control depends on active case finding or identifying not just those who seek care, but also those who might not. Nurses conduct community screenings, home visits, and contact tracing to identify exposed individuals early. Surveillance data are often used for planning and evaluating program performance. Each report we file, each case we detect, contributes to the bigger picture of national TB control. Community engagement is the backbone of this TB control program. Health education campaigns help reduce stigma and encourage early consultation. When families get involved, treatment adherence improves dramatically. Patients feel supported and less isolated. Community-based DOTS unit, often run by BHWs and volunteers, bring services closer to where people live, making treatment more accessible and consistent. Public health nurses serve as program coordinators and advocates. We supervise the TB DOTS implementation, monitor progress, and submit regular reports. We also conduct follow up visits to ensure patients remain on treatment and address any side effects or concerns. Most importantly, we act as educators and motivators, guiding treatment and also ensuring that patients complete their regimen while promoting prevention within the family and the community. Prevention in health facilities start with good ventilation and cough etiquette. Patients with active tuberculosis should wear masks in public and be encouraged to cover their mouth when coughing. Healthcare workers must follow infection control protocols, including the use of PPEs or personal protective equipment when handling TB patients. By protecting ourselves, we protect others and maintain continuity of care. Accurate documentation is vital. TB treatment cards and registers track each patient's diagnosis, treatment, and outcome. Regular reporting to higher health offices ensures accountability and supports data driven decision making. Good surveillance data is not just numbers, it tells the story of how the community's TB status is. The NTP also engages private physicians, NGOs, and partner organizations. The public private mix or PPM dots expands reach, ensuring that private sector cases are reported and treated using standardized protocol. NGOs assist in advocacy, logistics, and research, providing valuable technical support. Collaboration makes the program more inclusive, sustainable, and comprehensive. New technologies make TB care faster and more efficient. Digital adherence tools like short messages sending Reminders and electronic pill boxes help patients stick to their treatment. The e-reporting systems enable real-time data submission from local health centers. Mobile Dots Clinic now bring TB services to far-flung areas, supporting the Department of Health's Universal Healthcare Initiative. Innovation makes care more patient-centered and responsive to modern challenges. Despite these advances, drug resistance, treatment dropout, and stigma remain persistent problems. Rural isolation, limited funding, and health worker shortages also affect program reach. To overcome these barriers, PHNs must continue health education, advocacy, and partnership building, ensuring that no patient is left behind. As our Department of Health reminds us, TB is curable, preventable, and stoppable if we act together. In summary, TB control depends on compassion, consistency, and collaboration. Public health nurses are at the heart of this mission, leading community based TB management with empathy and excellence. Through early detection, consistent treatment, and community education, we can move closer to a TB free Philippines. Each patient cured is one life transformed and one community made healthier.